That does not mean, this does not mean that we cannot make progress. I would not be spending all this time and energy if I didn't believe we had a once in a generation chance to really bring Governor Lamont a great document with opportunities for change and opportunities to improve the system. So we laid out some reactions, some compensation recommendations. And so what we want to do is, in general, get your overall reactions, then talk about what you think the roles are that leaders can play. And then we're going to put yourselves in our shoes and ask you, what would you do first? But let's start first by your reaction to the compensation strategy. And you can either talk or raise your hand. I'm trying to think. We don't have that many people, so we could probably have a conversation. We'll just be respectful of each other. And if we get to the point we have to raise hands, we were Carla Horowitz. You were there, and I was wrong. It wasn't 1997. It was actually 1991, right? When we started.
Yes. I just really want to applaud, because I've been around a long time, and this feels like the first time that not only NAEYC, but actually the state of Connecticut is really paying attention and making this an initiative that must happen. And so the hindsight that I have about it not ever happening before, it has been maybe replaced by a little bit of optimism, which is unusual for me.
No, you have to be optimistic to build a program like you built on the budget you built it on. You have to believe in magic.
Thank you.
But we can't rely on magic anymore. We need to get down to brass tacks here. So other reactions. Thank you, Carla. Yep, Christine. Hi, Christine.
Hi, Beth. How are you?
Great.
Also applaud. Just a quick question, a clarification. When you say to align the compensation with EC state-funded programs, is that what the goal was from the screenshot? I don't have it right in front of me. I'm just remembering.
It's actually a really good question, because that is a big complication. You know, I started by saying it's complicated. You know, 70% almost of programs in the state are completely private programs. Mm-hmm. And much like we can't tell private businesses what to pay their staff, mm-hmm. We can't tell childcare centers what to pay their staff. Mm-hmm. But what we can do is strategize to use a state-funded system to improve compensation by using things like the compensation scale. And so the recommendation is really to use a state-funded system to drive some market change in terms of rates and wages. So it's sort of happening now with Care for Kids, where as Care for Kids goes up 11% a year for the next 3 years, you know, those full pay parents actually have to pay the increased rates too for the provider to collect the higher rates, or the provider just leaves those on the table. But, you know, so we're sort of seeing how it's happening. We've never had this kind of increase in Care for Kids that we've just passed this session. So we're trying to puzzle through, how do we use the state system to impact at least part of the market? And we're really open to ideas for other parts of the market as well, because we care about all early childhood. We want it more affordable for all families. We want it higher quality for all kids. And we want teachers to be well compensated, better compensated, no matter where they teach. But the work group had to dig into what can we impact. And I hope that's not too complicated an answer.
No, I think when you said state-funded centers, you're referring to centers that are full-year centers that are state-funded. Is that right?
Well, we have school readiness, child daycare, summer school day, school year, summer part day, summer full day. Most are full day, full year, but there's a good chunk that are not. So ones that we've just put out like 1,300 infant toddler spaces. Those are in all different kinds of settings.
So I will just throw out there that I think the biggest draw for the teachers that we've recruited are young teachers. I had one teacher who was a high school intern left, went away, became a teacher. She went to a bachelor's program, came back to us remarkably, and stayed and was with us for 8 years, but knew she had to leave as a young woman in her mind because she had to go to the public schools, not a state funded program, but the public school system in order to have a career that could sustain her life.
Yeah.
So I think you need to really think about that. This was a, a roll up your sleeves kind of gal, and not a fancy, person. She just knew that she needed that. And she went to the public school system, very unhappy to do so, was not happy when she got there, but she said, what can I do? I'm going to get paid almost twice as much. I'll have a dental plan, a medical plan, and a pension. So I'm just going to leave you with try and think about how to factor in that system as well.
Yeah. Thank you, Christine. Really great feedback. Kristen.
Commissioner, just before we jump to the next person, I was going to just flash up the slide that has the recommendations. I saw a request in the chat, and I'm guessing some folks, especially if they missed the first part, may just benefit from a quick refresher on the high-level recommendations.
Put up a refresher, but I like this feeling that we're talking to a group of people, so we'll go back and forth as needed. I think I said Kristen, and I'm sorry if I'm not going in order. I'm doing it the best I can.
Okay, so there's a couple, I think there's two Kristens, but
Kristen
my hand's raised, so,
Kristen
okay,
Kenner.
all right. The recognition that compensation is the key for all of this is, without debate, especially for those on this call. My concern is, I'm going back to something Rianne said years ago, not that long ago. It was actually right around the time Power to the Profession was being released. We have tinkered around the edges long enough. We cannot do this any longer without systemic additional infusion of funding. So my concern is that, or I'm looking to engage in some conversation. Are we looking at a plan that lives within our current budget, which will only continue the real concerns that are out there, or are we looking at a plan that looks for fully funding childcare and no longer tinkering around the edges?
Yeah, I appreciate that question, Kristen. I think the panel has to look at that. They will make recommendations around funding to the governor. And just for context, when you look at the budget that just passed in 2025, if you just take the lines that are early childhood education, they're up, the spending, just state spending is up more than 50% since 2022. So there have been significant increases so far. Governor Lamont has increased the expenditure. Not all of them are realized because 2025 is the biggest bump, and that'll be recognized. But to your point, the panel is going to look at the landscape, look at the value, and make recommendations. So I think, we take your comment seriously, and Rian is actually the lead advisor to this work group and has been stressing that to Deb and their teams throughout. And she's been a wonderful resource for us. So I appreciate that comment. I can't speak for, what's going to happen. We have a fiscally conservative governor, but a fiscally conservative governor who has made investments in childcare unlike any other. So I think it depends on the panel, and your input will have an impact.
Thank you.
Jade?
Yes. Sorry for being off camera.
Hi, Jade.
I was gonna ask, in the compensation schedule, I believe salaries are tied to credentials and degrees. And then I think similarly, the 3 educator levels outlined by NACE are tied to education pathways. I'm wondering, are we thinking about ways to support people who have been in the field for several years, who are doing amazing work, who have a wealth of knowledge, but maybe don't have a degree? Are we thinking about competencies? And I would also just raise, based on what Kristen said, that if we I think requiring time compensation to educational attainment. I think ideally we would have a system that supports educators in furthering their education. If not, I think we run the risk of exacerbating some of the inequities that already exist within the system.
Yes, thank you, Jade. What we showed you all to get ready for this conversation were the highest level recommendations, but when you there's some more detailed ones in the presentation that's going to the panel, it's full form, that supporting the existing workforce and not displacing them is an important priority. I do think that the compensation schedule was developed before the recommendation to move to a 3-level, and that's not a done deal at all. We're having a conversation about that. But I appreciate that feedback. And I think if you look at level 1, that's meant to be the 120 hours. It doesn't require a degree for that first step. And we need to align our professional development systems and scholarship systems to bring folks along. But the unifying framework is a far cry from what was 10 years ago. Everyone needs a bachelor's. So I think we take your comment seriously that we have to, and I know Leah's taking it down, we have to consider the existing workforce and valuing their contributions and making sure they're not displaced. So I appreciate that. Kristen, another Kristen B.
Thank you. And I don't know how to put the little hand up on my thing, so
Okay.
thanks. Quick question, and I'm sorry I wasn't at the first one. Has the group considered funding or reimbursing employees directly at all? And if so, I recently learned about a program that seems relatively successful in the state of Tennessee that's doing this, that I'm happy to send a link for.
Yeah, that would be awesome if you sent that link along.
Yep.
The only program we have that directly reimburses staff that we plan to continue is a qualified workforce incentives and the longevity bonuses that we did with our state funded programs last year and are going to roll out with the rest of the programs where the checks go directly to the teachers who've achieved different credentials or a certain number of years of service. So that program, between the wage supports and now round 3 of stabilization, we're trying to do this in stages because it gets very confusing. But the Tennessee program I'm really interested in. So if you send us that link or put it in there, we would love to hear about it.
I just put it in the chat.
Awesome.
And I learned about it. I'm a franchisee with the Goddard School, and I learned about it from speaking to another franchisee at our convention. And it's based on credentials. We help our employees apply directly because then we also verify their employment. And if you take a look at the link, it looks like it's been very successful in the last 6 months or so, maybe a year that it's been around. So maybe something for the group to look into.
Awesome. We will assign that to our work group and send them your link for sure. And I'm going to make this like a more wide open conversation by also saying if you have ideas, because there was one, and what role you think early childhood leaders can play in helping move this. Sophia. Hi, Sophia.
Hi, Val.
I know you're not
Hi.
there yourself, but.
No, I'm with actually 2 of my teachers. Okay, so we just newly opened a couple of weeks ago.
Oh, congrats.
Thank you. And we are going NACE route. So my teachers are bachelored, the majority, but healthcare, Beth, is the hardest for us right now. So my little group, I did the census, and it's going to be about $50,000 just on my end for healthcare. And then the other end is the teachers, right?
Wow.
So that $50,000, I look at it, that can go right back into their salaries, right?
Wow. Yeah.
And I have a teacher that has epilepsy. So when we had our first kind of meeting, she said, if something happens to me, do not call the ambulance. So that struck me because they can't afford it. So we really, our pipeline is dry. There's nobody coming into this field. So retention, paid time off, and I do that. I try to treat my staff like above and beyond. I really do, but they need health care.
Yeah.
They are no different than that kindergarten teacher sitting in that public school.
No,
There's no
they
difference.
need healthcare. We all need healthcare. Yeah. Thank you,
So-
Sophia. That's a really important point to rise up, and maybe an area we could make some progress in collectively. So I appreciate that.
Thank you.
Kate Vallow. Hi, Kate.
Hi, good evening. Thank you so much for hosting this. I really appreciate the opportunity to, just one more little voice to add in here. I share, the views of some of the things that people said previously, and I just wanted to kind of underline the importance of bringing benefits forward strongly for us. I'm sure that our program, we're a little nonprofit, right? And I'm sure we're not alone with some of the workforce challenges we had as a result of COVID. So we've always had a very long tenured staff. We've been graced with that over the years. Wonderful place to work, all those kinds of lovely things. And then the pandemic came and some of our older workforce did not feel comfortable continuing to work. So we're in the position now of just having such a young workforce that many of them, if I could just say it plainly, can't rely on partners yet for insurance and that kind of thing, right? Which is something this field has kind of tried to leverage over the years. So whatever we can, I'm sorry I don't have the slide kind of memorized. I'm trying to catch up with all of this, but I know that there's an idea there to kind of propose whatever we can do for benefits. I would just say that's a really important, key, critical element of this. So as we're building those schedules, I haven't looked at the steps 1, 2, or 3, but perhaps those could be tied with the cost of benefits to go along with that, right? And make that somewhat required. So it reminds me a little bit of the way that, your office has been really smart, for lack of a better word, when you've been giving funds to centers, you have wisely also added the funds to cover administrative costs, right? So that it feels very similar to me. If there could be some kind of structure to have the benefits built in. That is one of the most difficult things for retention for us, in addition to just not being able to pay, kind of not even coming close to the wages that the younger people are really hoping to get. And I cannot tell you how many more times can my heart take? I love you, but I'm leaving, right? So
those little notes on your desk that say,
yeah.
I need to talk to you by the end of the day. You're like,
yeah, right. And we've had such, it really is a lovely place to work. We've taken all those steps. I've been in so many of these, of the recruitment and retention meeting things. There's nothing else we can really do except the bottom line of offer more money. And frankly, we need help with it. So I was really excited to attend, previous meetings where I'm really understanding that the quality improvement systems that you guys are setting up are going to help people work towards attaining accreditation, because I'm really clear that, receiving funding, even for this proposal that's moving forward, the having school readiness is predicated on having accreditation, right? Which is also very challenging to attain and very high level. So just wanted to kind of add my 2 cents, but thank you. Thanks for your time.
yes. Kate, and I'll just ask our note taker, Leah, to make sure we hadn't considered sort of a tier when I picture the compensation strategies or the compensation guidelines, it's really all about salary. So you could imagine we could add in benefits as part of that package, because to Kate's point, it's about the money, yes, but the other things really matter as well.
Yeah, and that would also, I didn't mean to cut you off. I'm sorry.
No, that's all.
So rude. I got excited.
Excited, Kate.
It would also, that would really line up with the way that the public schools approach this with budgeting, right? So in their budget lines, they always have those salaries built in, all of the benefit costs built in. And I'm not in HR, so I don't know. I think that there's a professional term for that, but maybe somebody in the room knows. But it would be wise, especially if we want to align ourselves with the kind of professionals that we have that are aligned with public school professionals. So,
Great. Thanks,
thank you.
Kate. Anybody else? I'm watching for hands, either real hands or others. Is there anything in the chat, anyone from OEC that needs responding?
Beth, this is Margaret. I'm just
Hi,
wondering
Margaret.
just wondering if anyone else can see Kristen Bodenstein's link. I don't see it in the chat, and I thought it flashed across the screen. So Kristen, if you could drop it again in the chat, that'd be great.
All right, I just did it. I added a little extra note there about connecting the owner of the school. Do you see it there, perhaps? Sorry, the first time I just
That's okay.
pasted and hit enter.
I don't see it yet.
I don't either.
But that's okay, because we have Cracker Jack consultants listening right here. And
I
I
see it,
guarantee
Kristen.
within 24
I have
hours.
it.
It's tnwages.org.
Yep. We will.
I got 2 thumbs up, so somebody saw it.
Thank you.
Excellent. Yes, Christine.
Sorry to monopolize. I dropped
you're
a
not
couple.
monopolizing. The
I
conversation.
dropped a couple. There's I added 2 things in the chat as well about healthcare, because I do think your suggestion for that tier is really crucial. I think the point made about relying on staff that have partners who may be able to offer them healthcare. And sadly, I've had employees who have no healthcare because they literally choose to not pay anything and just cross their fingers because it's so expensive. But to that point in the chat, I put Washington, D.C. now fully funds early childhood educators through their public system. And if they have access to a silver level plan, and I think it's tiered, so it's based on income. So if you are a high wage earner, maybe you just get some access and not a full ride, but most people get free healthcare. And then the second thing is more of a band-aid for now for people who are really struggling. If you cannot afford to join a health plan as an employer, as the employer, because it is incredibly expensive, we participate in what's called an ICHRA. It's a national product to reimburse small businesses. So what happens is, if my employee as a single person participates in Connecticut Access Health as an employer, we can choose an amount to reimburse that employee, and we choose the amount. So we started out with reimbursing people. We could only afford to reimburse them $200 a month for their plan, which is very different than what that, I don't remember who mentioned it earlier, paying $500 or $50,000 as a buy-in.
$50,000 a year. Yeah.
Right. Crazy, right? So we started it, but you can set the rate. You could reimburse $50, and you can decide. For us, we just set it so we reimburse them for premiums only. We want to make sure that they had a premium, but you can be if you have a lot of money, you can reimburse them for anything that is health related, any health expense. Okay. It's an easy thing to do. There are many third-party people that you can work with to do this. We work with a company called People Keep.
People Keep. Okay.
But it's a national plan, ICHRA.
Yeah, I wrote it down, and I guess Leah did too, probably. Cherie, am I saying your name right? Excellent. Hi, Cherie. You're muted, I think.
Can you hear me? Okay. Number one, the compensation. I'm happy that we're talking about it because that was one of my biggest things ever. I incorporated a health plan in my program, and I noticed that it works. I have employees that do me for 8, 10 years and over 10 years. And I do this survey to ask, okay, why, how we have people that come in and I asked someone to hear, why do you stay? And you know what they told me? The health benefit. It's very high, very expensive. They have to out of their pocket too. Half, and we compensate the half, but we put health benefit where we make sure they have health insurance, dental insurance, vision. I can't match their 401k, but we go out and get somebody to come in, put it in there. They ask me for it, and we put it in there so at least they could save money. We give them life insurance. They could go in and pick the life insurance that they need. Other things that make it look like, make it feel like a career for them. Because they go to school for that. But they really appreciate the personal day, the sick time, and so forth. So I try to create that package for them to stay, and it's really worked. The compensation can't do everyone, but there's some of them come on. It's too much because how much they make to pay in, and some of them do go on the state and so forth. But it's there for them. Expensive, something I think about. I'm like, I can't, but I see that they need it. I do surveys for them. They ask me whatever we do, don't get rid of the health insurance because they need it. So I
Yeah.
think that would help with the
Yeah.
retention because I've seen it work.
Cherie, you make a really good point, because I think we have the health insurance under compensation, but it really, you're saying we should also have that under retention, that it's a way
Yes.
to both recruit and retain. So that's an important distinction. So thank you. Jade.
I have a question because I want to make sure I understand.
Yeah.
It seems like in a perfect world, hopefully we get the funding, we would be able to implement the salaries outlined in the compensation schedule. And I know that there are some adjustments that are being done, I think, related to the compensation schedule. But I was wondering, are we also looking at the wages outlined in the compensation schedule? And that's coming up for me just because I know family childcare educators are not typically working 40 hours a week. They're usually, I think, working much more than that. I think maybe like 68 hours a week on average. So I'm wondering, are we looking at just the salaries or also the wages?
Thanks, Jade, for that question. What this committee was recommending was looking at the full cost of care and implementing the compensation schedule. I don't know if someone on the call could put a link on our website to that compensation schedule. I think the panel would probably recommend adapting it to the unifying framework. If that ends up being where people think we should move, because we have 5 levels, it would likely move. What we've got to do is try, whatever we do, we've got to try to align all these systems we have in early childhood, because it's so fractured and directors are doing so many different things. Like right now, meeting the teacher qualification situation, if you're in a state-funded program, is so darn complicated. So this committee, this work group of our staff is like, we have to make this simpler, and we really should think about joining a national standard so that, you know, you don't want your teachers to leave, but if they move to another state, all that time and effort that was put in is a credential that they own. It's sort of very, to me, respectful of the person who's put in the time. I think we would use a compensation schedule that's on our website and then adapt it. We'd probably recommend that the panel adapt it for the unifying framework if that's the recommendation ultimate recommendation coming out of this work group. Kate.
Sorry. I just wanted to make sure I understood what you just said, if you don't mind. So when you're talking about potentially credentialing, you're talking about tying into a national framework, and you feel, do you know how, like, for public school educators, if you get your teacher certification in, like, almost everybody takes Connecticut's, but Connecticut doesn't take very many other people's, you know what I mean? So do we know that credential would be accepted in other places?
That's the idea. That's where we'd be ahead of the curve. But the idea is, much like there's this, you know, if you're a social worker, you have these competencies and you get your social work degree, and you can use that in every state virtually.
So
we're not going to create a credential like well, we're hoping not to create something like the teacher credential that's just good in Connecticut, which in many ways is what we have right now. We're trying to, the thing about the unifying framework is it was, there are probably some people on this call that were part of it. It was a very long process where family childcare providers, centers, small, large, CEA, AFT, the big teachers unions, everybody was a part of designing this. And, I would also hope that the public schools, one of the recommendations is having this work. It could work in an early childhood center and it could work in a public school, trying to align all of these items. And I'm not pretending I have power to change the public school approach, but we have a great collaborative relationship with the State Department of Ed, and the governor is all about breaking down silos and workforce. So, we do think the idea, and again, there's some faith built in, and Margaret Gustafson knows a lot about this, as does Deb Adams. So far, the board is not set up, but it is in process that there'd be some kind of national credentialing organization. So absent that, we're saying we're moving toward this, that everyone's agreed to in good faith, and setting up a system that's simpler. Doesn't mean it'll be simple for people that have particular credentials at this minute. I think the committee will have to make recommendations about that, about making sure, to Jade's point, we don't leave people out who've already done the work and fit our system, but build a system that going forward gives teachers something more useful. They put in the time, they have a license to practice, if you will. We all know the particular skills this takes. It's not easy. And I think the unifying framework set up in a way to have different tiers as well, so people see the pathway. Right now in Connecticut, we could explain the pathway to you if you have 20 minutes or so, but it's complicated.
That makes a lot of sense. Do you foresee the possibility, and I guess maybe this decision isn't made yet, but do you foresee the possibility that given what some people's credentials are already within, the registry and things like that, that there could be some grandfathering kind of stuff happen, or grandmothering, we should say maybe?
Yeah, I like the grandmothering. Well, those of you who paid attention to the center know the session know that we recommended a system that would simplify and that would grandfather. So
okay.
The agency has recommended that in the past. I can't say what the panel will recommend, but that has been a recommendation of the office in the past, again, to make sure we're not leaving people out who've already done the work that they've been asked to do.
Helpful. Thank you so much.
Mm-hmm. Zanetta, am I saying your name correctly? Zanetta? Okay.
Hi.
Nice.
I missed the 10 minutes of this Zoom
That's
call.
okay.
What I missed, but everything you just said applies also to family childcare.
Yes.
So there is the difference between, group daycares, centers, or family childcare. Everything you said, it will be it's applying to family childcares.
Yes. Our goal is that family childcare is just integrated into our whole system. We know, there are some differences. That's why we have different regulations, et cetera. But we plan to rely on family childcare increasingly if all goes well.
Oh, great, because we can be accredited. We can go for the education.
Absolutely.
So there's no really difference besides the size, but okay, that's great to hear. And then in terms of being refunded for education, so like there's a science of reading that I wanted to register for. Do family childcare have the right as the center where the teacher gets special accreditation or special training? When I applied for it through OEC, I was denied. So the family childcare don't apply there? They're not there yet?
No, family childcare providers can apply. You may have been denied because of the course of study, but it can be complicated about how that works. I don't know, Margaret, if you want to weigh in, or Laura, because every case is a little different, but we do support family childcare providers. Okay. But there are rules about, trying to help people get to the credential that they need. But I don't know, Margaret, you want to just weigh in there? And we're happy to talk to you individually too.
Okay, good. And by the way, thank you so much for the grant. And I just finished my bachelor degree. And so
Oh, so you have gotten scholarship?
you get a scholarship through OEC. So I
I
finished.
think you've just hit on the issue, which is that I think we only support up to a bachelor. So that could be a recommendation that you make, that the new system
But
support beyond the bachelor's.
this is more of a training for like a science of reading. We know that at age 3, like Haggerty, there are systems that help the children to prepare them for the concept of reading, right?
Yep.
Of course, those programs are expensive. So I was just wondering, could I, because I only have 2, it's only me and my assistant, right? So, yeah, so, but I don't want to waste the time. So I guess if you send
and we can, and I'm just gonna look at your name so we can reach
Beth,
out. Yep,
I
Margaret.
can definitely follow up with Zanetta. And for anyone who's interested in OEC scholarship, we have a great guidance and at a glance document that's posted on the registry webpage. So
Okay.
there is a policy of degree progression and degree attainment, but family childcare providers have an incredible opportunity because of the Family Childcare Union Agreement with OEC. And so we support up through the bachelor's degree and then also standalone business classes and classes to support NAFCC accreditation and renewal. So I can have a separate conversation with you because we won't take up the time while everybody's on the line. But I do want to just take a moment to make that plug because we have our education advisors are ready to help folks look at what comes next, and we're happy to field all those individualized calls. So check out the contact us at the bottom of any registry page, and that's where you'll find information. But Zanetta, I'll follow up directly with you. Thank you.
Thank you.
See that these are helpful calls. It's really helpful. We have 2 minutes left. So what would be a step you all would take if you were in charge, looking at this system in terms of compensation and the complexity with state funded, non-state funded? You can just chime in if you have a thought.
I think you have a really hard job and you're doing it really well. And you're not alone. I think the whole Office of Early Childhood has really been really, kind of fearless leaders this whole time. And, I can't speak for everybody in the room, but I'm pretty sure we're with you,
Thank you.
I'm not sure that I know what could be done differently, but I think having the recognition that those 4 categories that were presented really do have quite a bit of overlap, and that you're going to be thinking about some systems perspective, and also recognizing that scaling to something like state funded programs to begin with, you've got to kind of start somewhere, and latching onto a model that's already has a method to distribute funds and things like that makes a lot of sense. And then having that be scalable, I think, really also makes sense. So really, really excited and really grateful for the work that you're doing. And I don't know if I have any better ideas.
Thanks, Kate. That was helpful. That was really helpful. Childcare
have a-
directors are some of the most resourceful people around. You got to be.
I have a suggestion.
Yeah.
Compensation we spoke about, I said it's very important and I see why, but I know it's like a mixture of group of people that we're talking to, family daycare and so forth. But I'm just gonna toss in the 3-legged, and that's for for the state program. If we could make that stronger, and the 3-legged student, including the parent, and
Yeah.
OEC,
Yeah.
that would also help. If that's stronger, that could help with the compensation as well, to figure out how we put things and so forth.
Yes.
Because the 3-legged stool is not strong.
Yeah.
It's like a
Yeah.
two-legged stool.
We need to make sure they're all there. Yeah.
Okay.
Thank you. Thank you for that. Okay, everybody, you should have a message now. We're going back to the other room. Thank you so much. I think we had the best breakout room. That's my vote.